healthy life. Soul Food on Smooth 98.1.
Okay, we're now live on YouTube and we're going on.
All right.
Feed your mind and the rest will follow. This is Soul Food right here on Smooth 98.1, where we love music, we love life, we love you and your health and wellness. That's why we make sure that every Saturday morning from 8 till 8:30, we talk about it. We give you tips, recommendation, we tell you what to do with the help of our experts that we have here. So do not miss out on every Saturday from 8 till 8:30. Today, we are talking about Heartburn. I have said it a number of times. You can stream live on YouTube. It is youtube.com/smooth 981 FM Lagos. Again, youtube.com/smooth 981 FM Lagos. That allows you to join the live stream, drop your comment, ask your questions, and then share it with family and friends. And also for you to go back to watch the stream when we are done. So multiple things you can do with that. There is also the WhatsApp line that allows you to ask your questions as well. And there is the phone line that you can dial. So the call line is 014489981, while the WhatsApp line is 0809444091. My guest this morning is a physician as well as a lifestyle medicine practitioner, and her name is Dr. Nkechi Iwuala. Good morning.
Good morning. How are you doing?
Right?
Yes, you got it.
Thank you. Thank you for joining me this morning. All right, without wasting time at all, because 30 minutes is quite short if you look at it. So let's get to the basics. Chances are that everyone listening has an idea of what heartburn is, and they would have said, I am experiencing heartburn at one point or the other when they have some sort of sensation in their chest or their throat or their tummy. But medically, what exactly is heartburn?
Okay, thank you so much, Kim, for that question. Because I'm happy to be here once again. Thank you for having me. So I will try to be as simple as possible. So again, when patients come to say I have heartburn, what they are simply experiencing is a burning feeling, in their throat or in their chest that is caused by, active content in the stomach traveling up, down the food pipe, which we call esophagus. I'm sure a lot of us know that from biology that the stomach is made up of acid, really. So when that travels back, now start having those burning sensations. Because how acidic, how burning, acid burns, right? So now start having those burning sensations at the lower part of our food pipe. So that's simply what it means. However, if this continues over time, then it now becomes a disease we call gastroesophageal reflux disease. But we hope that because of this discussion we are going to have today, a lot of people will not get to that stage.
Okay, all right, then hopefully they will not get to that stage. That is if they listen. That is if they listen. So you have already started by explaining some of the symptoms, or better still, how heartburn feels like, that burning sensation. But aside that, is there any other symptom that tells you this is heartburn? Or is it possible for a person to experience heartburn and not be burnt?
I mean, it is called, like the reason it's called heartburn, right? So it is burning in that particular area. So yeah, there are some other symptoms apart from that. However, the commonest one is that, a lot of times it is pain that calls our attention to a particular condition. Yeah. So that's the first thing that a lot of patients experience. So sometimes they also feel bloated. There are times when maybe they lie down, they feel like the food is coming back to their throat. So they feel that food coming back to their throat. Sometimes if it progresses over time, they could have difficulty swallowing. They might have sour taste, in their tongue from the acidic content that goes back to the throat. A lot of people also feel like food is stuck in their throat. Yeah, there are just so many. Some people vomit, some people have nausea, but the commonest one is that brings them to the hospital is either that heartburn, the painful burning sensation, or maybe feeling of bloatedness.
Typically, for how long can these symptoms last?
Well, really, it depends. There's really no, so far, if you're exposed to that particular trigger, right, and you keep being exposed to that particular trigger over time, you keep having the symptoms. However, for some people, it may last for maybe like a few minutes to hours, depending on how long that acidic content stays in that particular area. So there's really no fixed time of how
Mm.
long it lasts. Mm.
Okay, so aside the exposure to that trigger you mentioned, are there other things that can determine the duration of the each episode?
Okay. Well, yes. Okay. For some people, I don't know if I should get into this talking about the risk factors. If
Yes.
somebody might eat, for example, beans. Okay, somebody might eat, for example, beans, and I mean they go on fine, they don't experience anything. But there's some other people when they eat beans, it's like they've inflicted themselves with. In fact, I don't even know what to call it, right? So yeah, there are certain foods that somebody might eat that will predispose them to having, this heartburn. So food like I mentioned, beans. However, there are some acts that that one can use to mitigate, that feeling they have from beans so that they don't lose out on the goodness of eating beans. And
Mhm.
then some drinks like soda, alcohol, spicy foods, fatty
Okay.
foods. A lot of us love fried foods. So yeah, fried food can also predispose one from. So I mean, if you don't eat those things, right, you may really not get the symptoms. And then smoking, then if one is overweight or obese, yes, it increases their chances of having this symptom.
Okay, so you've mentioned some of the triggers and the possible risk factors or causes. No, I wouldn't say causes, I would say risk factors
Risk
because we'll go back
factors,
to
yeah.
causes later. So you mentioned smoking, being overweight,
Yeah.
and you also mentioned some certain foods. There is soda,
Mm.
there is beans. Are there other foods? Because I know that is very important. In fact, if I were to coin that
Yeah.
question in another way, I would say what other dietary habits can increase the risk factor or yeah, increase the risk of a person having heartburn?
Okay, yeah. So thank you very much for that wonderful question. So we have mentioned beans, we've mentioned drinks like soda, alcohol, caffeine also. Then for habits, really, a lot of us are used to, or a lot of people, whenever they eat, maybe they eat on their bed, and then just immediately after they go to sleep or they lie down, right? So that short duration, the food has barely gotten into the stomach, so it just goes right back. Okay, so that's one. And then taking lots of processed food. So processed food like white rice, white bread, sausages, bacon. Processed food generally predisposes us
Okay.
to eat to having these symptoms. Yeah.
I feel like you if you want to talk to Lagosians, just say it, You don't have to say if you eat a little and then you go to bed immediately. Just say that you're talking to Lagosians. It's okay. We will not, we know you want to talk to
My
us, but
apologies. My apologies. My apologies.
all right. So if you're joining us for the first time, we're talking about heartburn. We have defined what it is and of course the symptoms. You know it when it comes to you. For instance, there is a burning sensation you experience in your throat or the lining, right? And then you have
Yeah.
bloating. There are people who can have that sour taste and that bitter taste, depending on it, at the back of your tongue, as the case may be. And also there are some risk factors, includes the food you eat, know the trigger. So the food you eat, starting with beans for a number of people. Then there is processed foods. There is the carbonated
So
drinks, soda
that
generally. What about chocolate?
yeah, some people experience that with chocolate. Yeah. I mean
Mm.
it has um the sugar in it is high, and a lot of times we don't even know what it's made up of. But
Mm.
if you want to talk dark chocolate itself isn't really bad. We know a lot of chocolate in the market is highly processed. So that some people may experience that as well.
So processed foods, you had that those are part of the foods you might want to check or look with in bombastic side eye. If you have
Yeah.
or experience heartburn, there's also fried foods. You've got spicy foods as well as those food that are fatty. And if you're also overweight, you might want to lose some weight because it can help to reduce those symptoms. Now, there were people that I have spoken to who did not experience any form of heartburn or when they became pregnant. that was an issue. Can you explain more?
Yes, in fact, I'm one of those people.
Interesting.
I'm one of those, yes, I used to have, in fact, then what I would do, especially towards the later part of the pregnancy, like towards the third trimester. So what happens is that because of the expansion of the womb, the baby, so there is increased pressure in the tummy, such that whatever it is, even if you eat any little food, there is easy, that pressure pushes the food, presses on the stomach and pushes the food down to the esophagus. That's the food pipe. So that's what happens really because of that increased pressure in the tummy. There is increased pressure on the stomach, which pushes the food down to the esophagus. After the food pipe is the stomach, and then because the tummy is growing, because of the growing baby, that pressure is there. So it's that pressure effect that causes that. It's
So
not
does
like
that go ahead,
after the
please?
pregnancy, a lot of times after pregnancy, after delivery, it goes away. For a lot of people, it goes away.
Okay. You already answered the question I was about to ask. That so does
I
that
guess
mean all
that's what.
through the baby is in
Yeah.
your tummy, you will experience that? Okay. Before we cross over to what you can do and how to prevent it, which I think is already embedded in knowing the triggers and the risk factors,
Yeah.
those are the ways you can know how to prevent it. But before then, Cruz on WhatsApp says, Gary is another one, causes heartburn for some people. And chances are that the Gary loving people will not stop this.
They won't stop Gary. They won't stop Gary.
It's just like lactose
Yeah.
intolerant people. They are the ones who love anything containing
Milk,
lactose most.
right? Yeah.
All right, then. So another one you might want to look at is if you lie down immediately after eating, or maybe you eat a large meal, and then, yes, you know yourself, if you belong to the classic or the category of people who eat and then go immediately to sleep. Well, there are people who are tired and they just sleep off. Yeah, so we won't blame them, but
You won't blame them. You won't blame. You just not to. I think we should just try not to make it a habit. Either we have our dinner before we leave work, or that's the. I feel like if you know the cost, right? If you know the risk factors, we may be able to, based on our lifestyle, because we all don't have the same schedules. So based on our lifestyle, you may have your dinner before leaving work, or Lagos traffic. So when you get home, you take a bath, and sleep.
all right, then. Thank you. So before we go to the possible treatment options, let's talk about the complications. So aside heartburn just being that discomfort you experience in your throat, your chest, what are the possible complications of heartburn?
Yeah, thank you so much for that question. Now, that complication part is an area we do not even want, like I said, patients to get to. They have fun, and then if it continues over time, it leads to what I mentioned earlier, that esophageal reflux disease. So what happens, based on this, if there is too much acid over time in that part of the esophagus, is that the cells there becomes transformed to what we call a precancerous cell, like a precancer cells, which means that it may lead to cancer, esophageal cancer later on. And then we call that Barrett esophagus, and we do not want that to happen. Because if somebody already has cancer, we all know what cancer is. A lot of people, when they hear cancer, God forbid, God forbid. So now we're telling you, if you keep having heartburn, of course, thank God we get to that. So Barrett's esophagus is one of it, and there's an increased risk of it developing to full-blown, cancer if it continues. And then because of again, I say, if we have an injury, for a lot of us, if we injure ourselves, there is a scar that forms. So imagine that constant acidic burn. Over time, that place becomes scarred, and then it becomes narrow, right? Such that it now be difficult for food to now pass through to the stomach. So you now start experiencing difficulty swallowing. You may not, even your favorite food, you won't be able to eat it again. You may now start losing weight. They're just so, and then constant pain, discomfort affects your sleep. We don't even want that to happen. But that Barrett esophagus and the fact that it can lead to stricture later on, those are the two common ones that a lot of people experience.
Well, I had to ask that question so that somebody does not think, well, it's just heartburn. I have been fine since 1960, whatever, and I will
Wow.
always be fine. Just know that there are complications, possible complications to everything, including that
Yeah.
seemingly harmless heartburn that you experience all the time. So now that you have heard the explanation from Dr. Nkechi, please take heed. We'll go on a short break, and when we come back, we'll continue, especially telling you how to maybe get rid of heartburn and what you can do about heartburn that you experience. You're listening to Soul Food right here on Smooth like 98.1.
Five, four, three, two, one. No, mic check, mic check. Switch track and get on a train of thought at five musings at five. Everything from entertainment, information, and more. So much to say. It's five music with five on the Smooth Drive every weekday at 5 p.m. It's 98.1.
Every day should be Children's Day, and children are the future of this great country, Nigeria, and their hopes and dreams will become our collective realities. Here's wishing every Nigerian child a happy Children's Day from myself, Mr. C, and the rest of the family at Smooth 98.1.
Happy Children's Day again. You'll never get tired of hearing that this morning. So extend the wishes and the greetings to children around you. Thank you for listening, and thank you for choosing Smooth 98.1, where we love music, we love life. Literally, that's why we are bringing this information your way, so that your life is not just kept, but kept in the best quality. Pain is a marker that something is wrong. So when you experience heartburn, something is wrong. And Dr. Nkechi has been shedding the light on the issue for us. You can ask your questions via WhatsApp, or you can call 01-448-9981. Cruz on WhatsApp asks a question about the relationship between heartburn and ulcer.
Okay. Thank you very much for that question, Chris. Okay, so what happens in ulcer? The common thing we call it peptic ulcer. Peptic ulcer occurs in the stomach, and then the duodenum, another part of the upper part of the small intestine, right? While for heartburn, it occurs in the lower aspect of the esophagus. So that aspect is like the link between the transition area between the esophagus and the stomach. It doesn't get to the stomach. So again, both of them are their symptoms and triggers may be related, but their causes are quite different. Okay, so we didn't mention the cause for that the heartburn earlier. So what happens a lot of times, because there's laxity of that area. So we call that the lower esophageal sphincter. It's the food pipe is a muscular tube. Okay. So that area, instead of it to be able to contract and hold back the acidic content from the stomach from going to the esophagus, it just become lax, and then there's easy passage. But that's not what happens in peptic or in ulcer. Ulcer, there is a wound. There's a wound in the stomach, again from acidic content. But over 90% of peptic ulcer is caused by a bacteria called Helicobacter pylori. So that's over, and then the other ones may be drugs like NSAIDs, which may also, for that drug, may also trigger the heartburn. But a lot of times, heartburn is due to our lifestyle. A lot of times, that's if there's already laxity of the muscle. The other is already like the triggers majorly are based on our lifestyle. I hope that answers the question.
Thank you. You can ask further questions via 0809-444-0981, or you can call 01-448-9981. You can also drop your questions and comment on YouTube, where we're streaming live at youtube.com/smooth981FM Lagos. Just remember to include your name, and we will take your comment. If you call, remember to turn down the volume of your radio set. Okay, thank you for going back to the causes. Really, I think it also escaped my mind. Now let's talk about the treatment option. How do you deal with it?
Okay, so now we have gotten to the meat of the discussion.
Yeah.
Well, okay, we can divide the treatment options into medical and non-medical. Okay, no, if I let me say three: lifestyle, medical, and non-medical. And the easiest and cheapest and readily available one that we can do is the lifestyle measures. So we already mentioned the triggers. So yes, we have to identify the triggers. I mean, that's the first thing, right? So we identify the triggers so that we're able to avoid them. So generally speaking, we shouldn't even be eating spicy food, fried food. They are not healthy. So if you now have heartburn and you know that this increases your symptoms, you want to avoid them or drastically reduce them. And then we had mentioned, as much as possible for dinner, have your dinner 3 to 4 hours before going to bed. So that gives enough time for the food to have gone down, gone through the stomach and down to the intestine. So there's really no stomach content going back to the esophagus. And then again, let's try. I mentioned increased abdominal, pressure from pregnancy. So now it's not only we know that when we eat, we are full, right? So it's best at this point when you know you have this symptom, as much as possible, eat smaller meals, eat in smaller portions. You don't have to eat a whole big bowl of eba or rice. And then you finish eating and then you're bloated, you're crying. You don't have to go through that. So just eat, in smaller portions. Maybe every 2 to 3 hours. Yeah. For this you can do that.
Mm.
Okay, so not lying down immediately after food, avoid sugar. Smoking, stop. There's no reviews. Just consider smoking. Alcohol, now it's been said that no amount, no quantity is good. But if you are high up there, just start cutting back on alcohol. Stress management is very, very important.
Mm.
If our body is under continuous stress, a lot of hormones are released that would cause ulcer. So want to ulcer or different kinds of things are released in the body. So want to sleep well, want to as much as possible avoid stress. And then when you want to sleep, prop up, your head so that the chest and the stomach, they're not all on the same level. They're not at the same level. So you may want to prop up a bit so that there is
Mm.
really no easy flow. There is like a barrier, that goes up. So yeah, that works as well. So I think those are if you're able to these are the little changes. It may sound so simple, but it helps. Avoid tight clothing. A lot of women are used to wear tight underwear, wear stuff looking at me like that.
The waist has to be snatched.
But yes,
Snatched
so
till you
it's
can't breathe. Beauty has to be
uh-huh.
maintained for the glam.
Okay now. Okay now. So just avoid wearing tight clothing. If you're already on medication, stop that. So those are the lifestyle ways you can, manage that. A lot of times it works. A lot of times. Because I mean we are avoiding the triggers and all. So for the medical one is medications. So medications that will stop the production of the acid content in the stomach or that will reduce it or that create a lining like antacid and they will now have surgery. I mean, do you really want to go through surgery to prevent? Do you want to go through operation? Just the lifestyle measures helps a lot. Then if the lifestyle measures do not work, then we now start medications and then surgery is the last. We don't even want to get to that. I mean, that's why
Okay,
we're having this discussion.
exactly. Thank you so much for that. Now I have an interesting question from Austin from Satellite, who says, is it true that adding vegetables to beans reduces the heartburn from beans?
Hmm. Okay, that's quite interesting. I'm not really, I don't have that information, but generally speaking, adding vegetable to beans works. But okay, maybe I should just mention the hack for beans for those of
Okay.
us that, yeah. So what happens in beans is that beans contain what we call raffinol, and it's water soluble, and that's like the what causes the bloating. So it is recommended or it is advised for us to soak our beans. Some people say a day or two, you may do 6 hours, but within between that time, you can just be changing the water intermittently. So the water you change, the raffinol goes with it, and then that reduces that bloating content. What that content that causes the bloating, which is the raffinol, it reduces it. But I mean, beans is very good. It's rich in plant protein, rich in fiber. So we don't want you to lose out on the goodness of beans. So So if you try that hack, it really works. So soak your beans, maybe 6 hours or 3 hours. Don't just cook the beans. Soak it, change the water, intermittently before you now cook it to eat. But yes, it's recommended. Please eat beans. Add vegetables to your beans. That's the whole essence. So that's our lifestyle message. All of your food should have vegetables,
Interesting.
right? Yeah. So that
I want
was
to take you back to something you mentioned while you were talking about the triggers of heartburn. Spicy food. You said you shouldn't be eating much spicy food, that it's not exactly healthy or something like that.
Spicy in sense of peppery, too much pepper and all of that. Well, of course, we know that there are herbs and spices, curry, thyme, turmeric.
Okay.
Those spices are very good. So I'm talking in the sense of
Pepper.
pepper. Pepper. Lots of us love pepper. I mean, if you're putting pepper on a wound, what happens? So that's the logic behind it. Too much pepper. So you already know that this area is at risk of having this particular, symptom, or you are predisposed to this. For some people who are fine, their sphincters are okay, they are very tight. I mean, and then they don't have, peptic ulcer. I mean, go on, eat your pepper away. But
Please,
if adding pepper,
this thing you mentioned, let me again use this opportunity to plug in my campaign against those who have been infusing pepper in puff puff.
really, but that's
Yes.
double tragedy.
That is, fried food, which is a possible trigger for heartburn, and
Pepper,
then pepper.
pepper.
Aside that,
Ah.
this is a personal campaign that I have been running and I don't intend to back down. Sometimes you just want to snack on puff puff, and then you go out to get puff puff, and the puff puff seller wherever tells you, oh, peppered puff puff is now in high demand. Why, Nigerians? Why? It's just the same way they thought about having pepper inside ice cream. Why, Nigerians?
Okay, I haven't heard about that.
Oh, I have seen
Pepper
that.
and pepper
Yeah,
and ice cream.
yes,
Okay, that's a
actually.
new one. That's a new one.
It just makes no sense. So please,
They're being innovative.
even, I'm sure this one you're very familiar with it, pancakes, pepper in pancakes. Why?
A lot of people love pepper. I mean, they don't, some people don't like bland food.
But there are other ways you can spice it up, not put pepper, literally. Life is already hard the way it is. Why make it harder with pepper? All right, well, thank you so much for all the explanation. I believe we are done. Or is there any other addition you want to put there?
No, just like, okay, let me see. My lifestyle message, really. This week we celebrated Global Lifestyle Medicine Week. And we have our 6 pillars. Let me just go through that. So eating healthy. So taking in lots of fruits, vegetables, plant food generally, legumes, herbs, seeds, all of that. Taking water instead of soda or alcohol. Water is your best drink. Regular physical activity, so you can walk, dance, jump, skip, whatever it is that works for you. Sleep well, have restorative sleep. Again, Lagosians, I don't know how you guys do it, but please, how you prioritize your sleep. I'm hoping you just sleep well, 6 to 7 hours. It's fine. Minimize stress. We are not going to say avoid stress because we are all exposed to stress, right? So find ways to minimize stress, take a breather. You can just take 5 to 10 minutes every day to just take deep breath alone, spend time in your car, at work, anywhere, going to the toilet, anyone. Just calm and breathe. Just escape, if you can afford vacations, nature walks, can do that. Avoid toxic substances, tobacco, alcohol, and other recreational substances. And then positive connection. Spend time with family, friends, loved ones. It goes a long way. Thank you so much for having me.
It's absolutely my pleasure, our pleasure. We thank you for blessing us with your presence and knowledge and wealth of experience. Thank you. If people want to catch up with you on social media, how can they do that?
Okay, my Instagram handle is I am Dr. Ketch. I am Dr. Drkech. I am Dr. Ketch. Facebook Nkechi Iwuala, LinkedIn Nkechi Iwuala, Twitter I am Dr. Ketch.
All right, I am Dr. Ketch. I almost added up there to make it catch up.
No, don't add up.
All right, thank you so much. We are done for today. But if you're
welcome.
just tuning in, you can go to our YouTube page. We will save the video for you. You can share it with your family and friends, especially those ones you intend to keep longer by making their quality of life really good. And if you have been experiencing the symptoms of heartburn, you're not sure what to do about it, or you have just been skipping past it, thinking it's nothing. Well, we have told you that there are possible complications, and you don't want to get to the part where you will be putting yourself up for esophageal cancer, I believe.
Yeah,
So,
yeah.
or Barrett's throat, you said.
Barrett's esophagus. Barrett's esophagus, that leads to cancer,
Yeah,
esophageal
so
cancer.
please prevent it. Always less expensive than cure. That's what prevention is. Next week, we'll be back with another thing. But for now, we will hang the curtain or draw the curtain on soul food and then get ready to have the children in the studio because it is Children's Day. You're listening to Smooth 98.1. Thank you so much.
You're welcome. You're
So
welcome. Thanks
you
for
can
having
share
me.
the link, for others that want to watch it. Thank
All
you.
right. Thank you for having me. Bye.